Hi, I'm Jesse Ahmed, your host of Valley News Now, and I have a guest today, Dara Lieberman. She is the Director of Government Relations for the Trust for America's Health. And right now, nearly 60% of our U.S. population has at least one chronic disease like obesity, diabetes, or heart disease, and treating those makes up the majority of U.S. healthcare spending. But it looks like there's not enough public funding to keep up with those needs. And so Trust for America's Health, TIFA, is out with a new report that shows us America's underfunding in public health. And Dara, I'm so thankful for your time. Thank you for being here. And please share, what does this report mean?
Thank you so much for having me. So, as you said, we have a relatively unhealthy population.
Mm-hmm.
We spend more on healthcare than any high income nation, but we have lower life expectancy than any other nation. And we think part of the reason is because there's a major mismatch in what we're spending money on. So, we're spending over $4 trillion on treating disease and on hospitals and things like that, but we spend only about 4% on prevention and public health. So trying to keep people healthier in the first place.
Yes. Oh, obviously, yes, if we can prevent that care. So that taps in a little bit to my background. Prior to doing this, I worked as a registered dietitian for 20 years and obviously love the power of preventative health. So what can we do, or what needs to be done in order to change that around?
Well, one thing we call for is ensuring enough funding for CDC, which is the major agency that funds public health at the state and
Okay.
local level. So there's a lot of proven prevention programs that don't reach all states. Like,
Okay.
some of the leading causes of disease and death in Minnesota and North Dakota are heart disease, stroke,
Yeah.
but those states only receive a small amount of money to try to prevent those conditions statewide. We
Interesting.
also call for investing in the public health infrastructure. So that means the workforce, really, trying to get the people and the technology in place in every health department just to provide the basic public health services. We just have not funded that enough.
So very, very interesting. What can we do? I mean, what can an individual do to support that, to try to get that changed around?
Well, we'd always encourage folks to call their lawmakers, whether that be at the
Yeah.
state level or their members of Congress, and tell them they value investing in public health. We know as we went into the pandemic that our public health system was already underfunded. It was
Yeah.
already working from a deficit. We didn't have enough people in place. They were using fax machines to try to track this new disease. So, letting your governor, your legislators, and your national lawmakers know that it's important to keep investing day in and day out.
Definitely. That is not a spot where I think we need to save money. It's a spot where we need to pour into the health of our people, our citizens. So thank you again so much. Is there anything else you'd like to share with me about the report, or things that individuals can do?
Yeah, I mean, there's just a really good return on investment for this kind of thing. So, we're short about 80,000 workers nationwide.
Wow.
So it would be a huge challenge to try to ask our health departments to fight whatever's coming next,
Right.
as well as the things that are facing our communities now, like obesity and chronic disease and the opioid crisis. So it's something for everyone to pay attention to.
Definitely, definitely. So let your lawmakers know that. And as far as workers too, we're talking, I'm sure, nurses, doctors, but also all kinds of staff that are involved in public health.
Right. So yeah, certainly public health nurses, but also epidemiologists and some of the disease trackers. So the
Yeah.
people to find out who is getting what, you know, and when.
Yes.
Those kinds of simple positions, we just don't have enough in most health departments.
Oh. Well, thank you so much for bringing light to this very important topic. I appreciate it so much. Again, it's Dara Lieberman, and she is the Director of Government Relations for the Trust for America's Health, for TIFA. Thank you again so much, Dara.
Thank you so much for having me.
It's Jesse Ahmet, your host of Valley News Now.